Good afternoon, everyone. My name is Maya Luria with TMC for Seniors. And in September, it is our Fall Prevention Month. And I'm very happy to be running a program today called Ready, Steady, Balance Fall Prevention Tips. I have two of our physical therapists here from TMC, Geneva Kaplan and Marija Zaruba. They both work in our new TMC adult outpatient therapies, which is sort of a newer. It's a newer outpatient therapies, correct? As far as the adult side was concerned. So I'm really thrilled that we've got some great programming over there, and they're going to share with us all about their fall prevention tips. So welcome, ladies.
Thank you.
So I'm going to go ahead and let you jump into your presentation. I know you've got some demos as well, but we'll go ahead and start, Geneva, with you, and then I know, Maria, you're going to present afterwards.
Hi, I'm Geneva Kaplan, physical therapist at Tucson Medical Center. And we know that 1 in 4 older adults fall annually. And so it's really important that we try to prevent those falls. And one of the top things you can do to prevent falls is actually have an eye exam yearly. So let's see. So how do we balance? Our eyes are constantly trying to predict what's going to happen next based on the information that we're seeing in our environment. And if we have problems with depth perception, for example, we could miss a curve, or even a small uneven surface can become a major problem. So again, our vision is just one of the most important things that predicts what's going to happen in our environment. And so, for example, in this picture, you might notice if you focus on the bookcases in the back, there's a different sensation than if you look at the slant of the walls there, because again, we're trying to orient with what our eyes are getting, where is vertical. So just that linear information. And then how does it make you feel to look at this picture, for example, as compared to that other slanted room? So anyway, so if we have an extreme loss of our visual acuity, which acuity is basically, if you look at this chart, it's my ability to tell if that's an E or an F, just those fine lines. And often if you go to an eye professional, this is one of the first things that they will test. We know that if we have a loss of acuity, that can actually be a major risk factor and make us walk differently and really affect our balance negatively. So let's see. So balance is actually 3 systems. We have our vision, our vestibular system, and our somatosensory system. And those 3 systems, just like the gears, are kind of all working at the same time to help us stay upright. And our somatosensory system is actually receptors in each of our joints, muscles, and tendons that tell us where we are in space. So if there's stretch or tension or a change in position, that system says, okay, now my arms are here or my feet are here. And then, like I said, our vestibular system is actually inside of our ears. We have 3 canals on each side, and they sense if there's a change in the position of your head in space. And on the inside of those canals, we have all these little hair cells that are called cilia, and they look like this. And when you move your head, there's fluid in there, and these little rocks that they're called otoconia, that move, and the rocks hit the hair cells, and they tell us, oh, my head turned to the left, or I looked up. So that system is very sensitive to, again, changes of positions of your head in space. So really important, if you become dizzy when you are getting up from laying down, or from sitting down to laying down, or if you get up out of bed suddenly and the room starts spinning for a few seconds, it's possible that there's a concern with that vestibular system. And it's really important that you get to your doctor as soon as possible and get some screening done, because you may benefit from seeing a physical therapist trained to treat that particular concern. So, and actually we have a couple in our clinic, so. Let's see, also if someone's had a fall recently, those crystals can get knocked out of place, and that can also make you feel dizzy when you change positions or turn suddenly, so. Let's see. So some balance changes with age. We know that our visual acuity, or the ability to tell the E from the F or E from a W, that is impaired. Our ability to tell contrast. So for example, on my slide, you'll notice there's blue and orange, and there's like a high contrast difference in those colors. So that can be actually a big concern too, which is why if you walk around in various places in Tucson, if there's a step or an uneven place, a lot of times businesses will mark those areas with yellow, so there's higher contrast. Depth perception can also diminish with age, and that's also a predictor of falls. So there are some solutions to those three things in particular. Sometimes we'll do prisms or special lenses that help if someone has a peripheral vision concern, or we'll tint their lenses so that you have more contrast. And then also another concern that I think is very important to discuss with your eye care professional is considering having a set of glasses for close-up work versus far away things. Like driving glasses is a very common concern. It's like if your vision is different or you're using bifocals or trifocals, that can be a major concern. If you think about someone walking on, say, a flight of stairs and they have 3 different lenses, try to make out where's the next step in space if you have 3 different lenses. So that can be something to also discuss with your professionals. Let's see. So moving on. So we have 3 major balance strategies that we use to help us stay upright. And I'm going to go through a couple slides, and then Maria and I will actually demonstrate these for you. So, let's see. So the first strategy is an ankle strategy, and it's exactly what it sounds like. The person is going to move from their ankle joint, and you'll see this in a moment. And then the hip strategy is exactly the same idea. We're going to try to keep our balance from the hip joint. And then a stepping strategy is exactly what it sounds like as well. When someone loses their balance, they have to take a step to change where their base of support is. So let's see. And then we also have a suspensory strategy. So Maria and I will demonstrate those for y'all now. So the ankle strategy, if let's say the wind was to blow Maria forward, she would sway by lifting her heels, or if someone pushed her backwards, she might sway by lifting her toes. So that would be moving from her ankle joint. And if you want to turn and face that. And then moving from the hip joint, if something were to jar her, like she's standing on a moving train maybe, that's where she would react, is in that hip joint. Or maybe from bending forward or back, if someone was to push her or something jarred her, that would be a hip strategy. And then a stepping strategy, if something really, really higher force happened where she actually got pushed, she would take a step to actually keep her center of gravity, which is around the belly button region, over her base. So again, if something jarred her. And then a suspensory strategy on the slide, if something were to make Maria, she would actually shorten or lower her base of her center of mass lower to make her more stable is the idea. So the last one too, which I have another picture of, is a reaching strategy. So let's say something threw Maria off balance, then she would do something like put her arms out to try and catch herself or protect herself. So, thank you. And then this is just another picture of the reaching movement. And this is an example of, this is our boss trying not to fall off of an unstable surface, the Bosu there. And she's wearing the solo step, which is a harness system that we actually are, I think, one of the few in Tucson that has this system that we can kind of practice some different balance exercises while being in a fall-free environment, because you just kind of sit down in the swing if you were to lose your balance. So let's see, but Maria will talk some more about that. So in terms of some other things to consider for balance, so we know the majority of falls that happen in older age happen while walking or due to a trip or a slip. And so our ability to take a very quick step in multiple directions can really potentially prevent many falls. So just kind of on this slide, it's like our ability to take a longer step or to step in multiple directions is something we need to consider when we're trying to prevent a fall. And so again, just these are the balance strategies, just another recap: the ankle strategy, that hip strategy, suspension, and stepping. We definitely can predict someone's risk for falling based on a multitude of information. If they've had a previous fall, we know that certainly would predict future falls. The environment that you live in can certainly make a huge difference. If somebody is reliant on a car all the time versus actually having to walk around their environment, that is a huge factor, because it's like your environment demands that you take steps in multiple directions or on uneven surfaces. We also know that how fast you walk is very much predictive of your fall risk. As we get older, we know that people tend to take shorter steps and walk slower. So that's something we can definitely address. Also, your leg strength is hugely predictive of falls. So just a few things to talk about there. This is one of my favorite slides. So Milton, Fritz, and Lasardi put out this wonderful graphic of walking speed. And we know basically that if you can walk at about 1 meter per second, which I believe is about 2 miles an hour on a treadmill, just to give you a reference, then you're less likely to have a fall, you're less likely to depend on someone else for your activities of daily living. Basically, life is just a lot more independent and safe if you can walk faster. And so you can see on the far right there that if you can walk, I believe it's 1.6 meters per second, but this slide is saying 1.4. You can safely cross a street, because most streets are timed to go about 5 feet per second, or 1.6 meters. So, and again, we can predict hospital admission based on how fast somebody walks. So I think that's pretty powerful information. One other bit that is, I think, really important is that we know if you're getting 5,000 steps a day, that can actually maintain your bone density. Not build more bone, but just maintain your existing bone density. So again, just another reason why walking is one of the best exercises for everybody. So Maria's going to talk about this some more, but I just want to give a quick overview of what we can improve in terms of physical therapy. We would address, your strength, your flexibility, your balance strategies, your endurance. Those are some big things we can affect. And then we can compensate if somebody has, neuropathy, or they can't feel their feet. Then we can compensate for that by giving them, for example, this is not the only thing we would give, but the walking poles, those Nordic walking poles in the picture, are a great tool for someone who can't necessarily tell where their ankles are in space as well. We can also compensate for some vision changes. There's a whole specialty of just low vision, but again, we're using different tools to help compensate for some different impairments that a patient might present with. So let's see. So those are my references, and we will pass it off to Maria unless there's questions right now, or Maya.
No, I'd go ahead and keep going, and then we'll take all the questions at the end. Thank you, Geneva.
Thank you.
And we will share this presentation too with anybody who had registered.
Oh, sorry.
Okay. Sorry. Hi, everyone. Let me pull up my presentation here. The mouse is doing something funky over here. Let me see. Oops.
Oh, sorry.
Oh, there it is. Okay, found it. Okay. And play. Okay. Hi, everyone. My name is Marija Zaruba. I also am a physical therapist over at Tucson Medical Center Outpatient Therapy. And now we're going to talk about falls prevention and how exercise fits into the picture. Okay, so Geneva did a great job discussing all of the factors that go into our balance and that can contribute to falls. So this list right here is by no means exhaustive, but these are some important things that can relate to our fall risk, right? Now, this next slide, I just want to highlight all of the things that PT can help with. And medications, right, over here, and depression. We can't necessarily address that, however, other medical professionals can. Visual impairments, one of the occupational therapists that works at TMC Outpatient does work on some visual strategies for patients, and there are things that PTs can do with you as well, right? So there is help available. All right, knowledge is power. So according to the CDC, falls are preventable with risk assessment and exercise. And exercise can decrease fall risk anywhere from a conservative 13% to 40%, although some studies show a reduction of up to 50%, even higher depending on which interventions are used and looked at. So let's talk about risk assessment first. Screening questions to ask yourself right now. Have you fallen in the last year? Were you injured? How many times did you fall? Think about those factors, right? Do you feel unsteady when walking or standing? And do you worry about your balance? Okay, these three key questions. Get a piece of paper and write down yes or no, right? And keep those in mind because we will come back to this. Now, I want you guys to focus on what's in the red box here. I'm going to go through these questions. This is just a longer screening form that digs into a little bit more detail. And I'm going to read through them, mark yes or no for the answers. The first two questions, if yes, those are worth 2 points. The rest of them are 1 point. Okay. I have fallen in the past year. I use or have been advised to use a cane or walker to get around safely. Sometimes I feel unsteady when I am walking. I steady myself by holding onto furniture when walking at home. I am worried about falling. I need a chair. I need to push with my hands to stand up from a chair. I have some trouble stepping up onto a curb. I often have to rush to the toilet. I have lost some feeling in my feet. I take medicine that sometimes makes me feel lightheaded or more tired than usual. I take medicine to help me improve my mood or sleep. And I often feel sad or depressed. Add those up. If you've scored 4 or more, that places you in a higher risk category for falls. So we would love to see you in PT. I also wanted to show you this. This is also from the CDC's STEADY initiative. That stands for Stopping Elderly Accidents, Deaths, and Injuries. And it's also, let's see, you can find the brochure online. I've got this brochure in person as well. Geneva talked about how some of the big things to look at would be, leg strength, your walking speed, your environment. So this addresses home environment and all of the major risk factors within a home. So look through this, find it online. If you find any of these things are true of your own home, enlist the help of family or friends to help you fix these issues, okay? So you might be wondering, well, what should I do now that I know that I'm in a low risk category or a high risk category? So if you scored 0 on the first group of screening questions, so those 3 questions, and less than 4 on the screening questionnaire, we recommend community-based exercise program. And to talk to your doctor about your vitamin D and calcium levels. That's out of the scope of this talk as to why that's important for balance, but research is showing that there is a correlation. So regardless of if you're low risk or high risk, talk to your doctor about your vitamin D and calcium. Okay, if you scored yes on any question on those first 3 questions, or 4 or more on the screening questionnaire, get yourself a referral to PT. We'll do additional testing to determine your individual deficits. Like Geneva said, we've got 3 major balance systems: somatosensory, vestibular, visual. Which of those is lacking for you, right? There is no one-size-fits-all intervention, so we'll help you figure out what exactly those deficits are, okay? So part 2, part 1 was risk assessment, right? Part 2 is exercise. So think multifactorial. Oops. So something that's really helpful is to think about static and dynamic balance. These are 2 things that we often think about in PT. So your static balance is when your base of support, your center of gravity, isn't moving too far out from where you're already standing, right? Things like washing dishes, changing a light bulb, standing exercises like bicep curls, right? You're not really having to move around, but you're moving your arms. And then dynamic balance. So that would be like walking, jogging, step aerobics. Your life includes both elements of static balance and dynamic balance, right? So ideally, your physical activity program also addresses both. What kind of exercise is best? Well, we know that aerobic exercise is good, walking is good, and you'd want to follow American Heart Association exercise guidelines. So 150 minutes of moderate intensity exercise per week, or 75 minutes of high intensity exercise, or mix and match, right? And strength training is also good. Again, leg weakness is one of the greatest risk factors for falls. However, strength training on its own is not enough. It's not effective on its own. What's better is to do a multifactorial balance program. And this is what we would help you develop in PT. We would address strength, we would address your aerobic conditioning, and then give you specific balance and coordination drills to work on, right? Interestingly, Tai Chi is also really good. There was a 2018 study that looked at 670 individuals that were placed into 3 different treatment groups. One of them did just stretching, another one did a conventional balance program, and then another one did Tai Chi. And the folks that did the Tai Chi actually improved the most, and they saw the greatest fall reduction. So that's also a good thing to go into. And evidence-based programs. Evidence-based programs, exercise programs, are community programs that are available in Tucson. They are backed by science. There has been research into them that shows that they are effective, and we'll talk about those a little bit too. So the role of community-based programs, these are appropriate for people who are at a low or medium risk for falls. If you're at a high fall risk, talk to your PT or the program facilitator to see if you can safely be accommodated, because these programs often try to challenge your balance a little bit, so ask first. Community-based programs also help you maintain or improve your balance after discharging from PT. You can learn new skills in a dynamic and variable environment, which is so important, right? Our lives are dynamic and variable. No time crossing the street is going to be the same as the previous time, right? There's always going to be a different car going by. Maybe someone calls your name. Maybe there's a new crack in the pavement, right? Things change, so your program needs to change too. It helps you screen yourself, right? So you're working on something and you realize, hey, I'm constantly having issues with stepping onto my right foot, right? And then you can bring that forward to your PT. And it also helps to challenge yourself in a social setting. The role of PT is to identify specific neuromuscular and musculoskeletal impairments that can impact your balance. Think of that long list earlier, right? We tailor your treatment plan to target these impairments. And think of PT as a yearly checkup like the dentist. So even if you're at a low fall risk and you feel like you don't really have any issues with your falls, we would love to screen you and see if there have been any changes in your performance since the previous year. This is a model that we're moving more towards in the future. Insurance coverage for screening is spotty right now, but we're working on it. And we prepare you for community-based programs. And we design a challenging and progressive program. That's really important to actually improve your balance. Like I was saying earlier, there has to be variety. and we help you make mistakes in a safe environment to encourage motor learning. So Geneva mentioned that we have the solo step harness system. So we can really push you to the limit of your balance and help you make mistakes where you'll remember, right? And that motor learning can happen, and you know what your limits are, but you're going to be in a safe environment and you're not going to be injured. PT and community-based providers work together. So don't think it's just one or the other. This is a spectrum. It's important to stay active throughout your life. So both PT and community-based providers have our roles. Here are some falls prevention and balance classes in Tucson. Enhanced Fitness and A Matter of Balance are both evidence-based programs. We don't have, I believe, we don't have Tai Chi for Health. That's another evidence-based program. I might be wrong. It might be available in Tucson. We'll see if we can find more information about that. But I did see that we will have Tai Chi 24 form offered by Tucson Parks and Rec October through December on Saturdays. There is seated Tai Chi as well if you're not so comfortable standing to do exercises, if your balance is a little bit more impaired, and that's offered at the Flowing Wells Community Center. Silver Sneakers is also really great. Medicare covers it, and it's offered at gyms throughout Tucson, and they're classes that are specifically built for older adults, so you can kind of get it all. Okay, now exercises. I'm sure you guys are very curious about these. So Geneva is going to help us demonstrate some of these exercises, and I'll tell you why they're important. Okay, so let's do the calf stretch first. So the hip flexor and calf stretch. So you'll want to get into a lunge, okay? Perfect. All right, you'll want to squeeze your glutes, okay? And then you're going to bend that front knee forward, okay? And then you should feel a stretch. Let me see if I can, you should feel a stretch right here, right? At the front of the leg, so the leg that's behind you. And you may also feel a stretch in through the calf right there, okay? So really important that you have good hip flexor flexibility. We see often with people who have a lot of tightness in the hips that you can't fully extend, right? And that's going to change, yeah, you're stuck there. And that's going to change your center of balance and make it harder for you to regain your balance. So work on that one, okay? Now, calf stretches. You can do this while seated or sitting on the floor like this picture, this cartoon. You'll want to grab a strap or a belt, something that isn't stretchy, and then pull your toe back, okay? And you'll feel a stretch through your calf. And this is going to help with your ankle mobility. A lot of patients that we see in outpatient therapy have poor ankle mobility, and that is going to impact your ability to do the ankle strategy like we talked about earlier. So keep your ankles mobile, right? And then a hamstring stretch. You'll just get rid of that strap. Put your heel down, stretch your leg in front of you. Perfect. And then bend forward at the hips. And notice that Geneva's back is staying straight. So she's not bending at the spine. She's truly bending forward at the hips. All right. And you'll, exactly. So you'll feel the stretch at the back of the thigh of the leg that's propped forward. Okay. Hamstring attaches to the pelvis. If that muscle is really tight, that can also impact your movement patterns. So again, just keeping everything flexible so that you're not pulled too much one way or the other. All right. Now for exercises, if you are already active and you feel comfortable doing so, keep doing what you're doing. Swim, walk, jog, do all of these things. Now, if you're limited by a fear of falls, or if you have an injury or pain, come see us. We want to keep you mobile and keep you moving because that's going to help reduce your fall risk. So even if you don't feel like your balance is necessarily too bad, but you're experiencing hip pain when you're running, and if that's preventing you from going out and doing that thing, come see us, we can help you. All right, another exercise that's really great, sit to stands. Geneva's gonna show us these as well. All right, so pretty straightforward exercise. You're going to stand up and then slowly sit down. This is key. Make sure you don't just plop down. Yeah, you really have to control that descent. And then go ahead and stand up again. And you want to make sure that you're fully straightening up too. So don't leave yourself hunched forward, right? You want to get that full extension. This is going to work on your glutes, your quads, and your hamstrings. Right? And then calf raises.
Or actually over the chair.
Yeah, use a chair to help you balance. And what Geneva's going to do is she's just going to lift up onto her toes and then slowly come back down. Okay? So, yep, perfect. So for doing these exercises, if you are a little more deconditioned, start with 2 sets of 8. If you are a little bit more active, you may start with 3 sets of 10 of these or 4 sets of 10 and see how you do. Delayed onset muscle soreness is really common, so don't go ham on this. See how you feel the next day and kind of work up from there. And if you have questions, again, a PT can help you with that. And another interesting point about this, so we know that people with hip OA, that's osteoarthritis, compensate their turns by using plantar flexion. That's basically a fancy term for you push through your feet a little bit more than other people do. So having good calf strength is helpful. Okay. And then stay steady. These are balance exercises that we often give to folks. Let's see. So with a chair in front of you, right, you want to put one foot directly in front of the other, like you're standing on a tightrope, okay? And then you can see how much hand support you need, right? If you're pretty wobbly, you know, keep a finger on, yeah, you can use the wall and just see how you do. Can you hold for 30 seconds, right? Yep, and that's another good way to do it. And then single leg stance, right? So balancing on one side and try to keep your hips level as you do this. So don't let one hip start to drop down. She'll show you what I mean by that. So try to avoid that, right? Keep yourself steady. If you need to, hold on to something, right? If you're unsteady. And chairs are okay, especially if you've got a steady chair, but I usually recommend using a counter because that's definitely not going to move on you. So both of these are static balance exercises. For something a little more dynamic, working up to it, you can work on weight shifting. So weight shifting from one leg to the other. So this is the easier version, right? You can progress it to stepping if that's a little bit too easy for you. So you step from one side to the other, and you can go in all directions, side to side, right? Forward, back to center, back, right? But always stay close to something. Okay. All right, so I hope you guys enjoyed those exercises. Again, there are so many directions that we can take these exercises. There's so many additional things that we can do here. If any of these were too difficult for you, please stay safe. Don't do anything that you don't feel safe completing. Alternately, if you know that you're uncomfortable with falling or you have a fall history and you want these progressed, again, we can help you. All right, so takeaways. Falls are multifactorial, and physical therapists are trained to consider all of these factors and build a program specific to you. Balance can improve with the right kind of practice and exercise. It's like a muscle. You don't use it, you lose it, but you can also work on getting it better. And finally, if you scored yes on the first set of screening questions, or 4 or more on that second set, or if you're simply concerned about your balance, come see us at TMC. And here are some resources and a couple of the papers that I referenced. Thank you.
Thank you so much. That was great, Maria. I do have a couple of questions I wanted to ask. One is sort of about, I know you mentioned that there were some environmental factors, of course, in people's homes. Can you sort of highlight what things people should watch out for when they're at home that could be a fall risk for them?
Yes, if you have any throw rugs, Get rid of those. Yeah, throw them out. You know, but that's a really common thing that people will trip over. Your toe can catch on the edge of it, and then you end up peeling it up and then falling over it. Any kind of clutter, definitely move that out of the way. Let's see. Lighting is another really big one. So Geneva mentioned that our vision tends to become less acute, and there's more difficulty in differentiating contrast. So having good lighting so you can see the contrast between things, and then you're not running into something. So night lights as well. If you are someone that has to get up in the middle of the night to use the bathroom, make sure you have a night light so that you can see your way.
That's great. And pets too, right? I know we all have pets, so they tend to get underfoot.
Yes.
So that's great. So the other question that had come in was regarding at what age should you start to, begin your fall prevention steps? Is there a certain age that somebody needs to be concerned, or should they just always walk and just keep strong from the beginning, maybe?
You want to take
Yesterday. Yesterday is the right age.
Okay.
Primary prevention of falls is actually the goal. So
Okay.
let's keep it from someone even having the problem,
Yeah, and I love that you mentioned that it's 5,000 steps a day, and so that it's a number that is pretty, can be reached and that people can strive for, and I think that's great. I know over here at TMC for Seniors, we're actually doing a walking club now. We're just starting that, and so we're gonna, I guess we'll see what we get to on our walk, just for an idea as well. What about if somebody wants to make an appointment? I do have the phone number here. So does that require a referral to come see you for any of the programs?
Yes.
Okay. So if they want to make an appointment at TMC Adult Outpatient Therapies, somebody should call 520-324-7005. And can you tell us where you're located?
Yes, we're across the street from the main TMC campus. So we are on the south end of Grant and Beverly.
Wonderful. Okay. Well, I want to thank you both for being here. It was a great presentation. I love all of the demonstrations and the way you were able to to figure out how to do that in our space. So I really appreciate it, and I want to thank you for being here. Our next topic is tomorrow. We will be talking about an anti-inflammatory diet, Put the Fire Out, and that is with Mary Marianne, a PhD from the U of A Nutrition Department. She will be on at 10 a.m. on Wednesday, September 22nd. So we hope you'll all join us for that. And thank you, ladies, for being here today. And we will go ahead and also share your presentations for everyone so they can make sure that they get those links as well. So thank you for being here.
Thank you.